Hello everybody, we are going today to shoot for you videos, demonstrating videos for peeling. We have two patients with two different skin types and accordingly with two different peeling agents. I hope these videos will be of benefit. Finally, I want to say that peeling is a kind of art, not merely a science. You should have the passion to love peeling. If you love peeling, you will get your patients the best results. Thank you. Hello everybody, we are going to do a peeling session today. Through this journey, we will know the steps of peeling, assessment of the patient, details of the procedures, care after the procedure. Let's make assessment for our patient first. We have a nice girl from Alexandria. Her skin type is skin type 2, we can say. Regarding complexion, she's skin type 2. She's a little bit seborrheic, but she washed well her face before she come here. She has little bit active acne and acne scars at the same time. I think she still developed new acne lesions. And she's a skin type 2. She's well prepared, as we will discuss in the lecture. So choosing the proper peeling agent now, I think we will do a pyruvic acid peeling. Okay. This is the pyruvic acid peeling. This is a concentration. It is nearly 45%. Peeling acid should be refrigerated, it's cold, and should be kept in dark colored glass because it is photolabile. How we will use the pyruvic acid, how we will do the session, this will we know in the further steps. We will do now a peeling session using, as I told you before, pyruvic acid. Pyruvic acid is 45%, added to lactic acid 5%. This is a special formula done by a special pharmacist. This formula should be refrigerated and should be kept from light. First step in our session is degreasing the face using alcohol. Okay, we will make just decreasing, efficient decreasing by alcohol, or if your patient is so seborrheic, you can do this by acetone. You see, this is meant by degreasing. This step is important and make your peeler more active and able to penetrate more deeper layers. And this proves that our patient is really seborrheic. He is not a dry skin one. Another time of decreasing of all face parts, and you look to the cotton. It take away the dirt and the sebum, especially these spots, because by nature this skin is resistant to peeling a little bit resistant to peeling. This is responsible to peeling. This is sensitive to peeling. Okay, after degreasing, we open our bottle and we put in a separate bottle, we put like 2 ml of the peeling agent, just 2 ml, like that. We will use this amount in our session and we close the main bottle. Please don't use the cotton swab and put directly to the main bottle. Now, cautiously, you approach the patient. If you are not so confident in the session, please, you may have assistant to carry for you this peeling agent. You put your cotton piece like that. Try to make it not super saturated as I do. Not super saturated. By such maneuver, And we will make layers. We will start from the forehead like that way, like that way. You do rapidly try to make the full forehead and make encroachment on the frontal hairline. Then we make the nose. After that, you assess the saturation of the cotton swab, and after that you do the cheeks. Okay, another one. And you keep asking your patient, how do you feel? انت حاسه بايه؟ في حرقان؟ الحرقان فين؟ Let him to point to the painful spot. حاسه بحرقان فين؟ Okay. Come focus, and you may start to see the erythema. The end point of your peeler now, pyruvic acid, will be erythema. When the cotton swab not super saturated, you can do these parts. You can do these parts like that. Be gentle. Don't make pushing against the skin. Okay, this is the first layer of our pyruvic acid, and we are going to do the second layer. The end point will be erythema. You should see homogeneous, obvious erythema. Again, we will start from the forehead like that. The nose again. The cheeks, you have to stretch the skin to make the movement of the cotton swab as smooth as you like. Don't forget the temple area. Here again, please. You have to be cautious for the patient eyes. If you are in confident for the process, you can use goggles for your first time of practice. Again, we will do the oral area with very little feathery brushing. And you should stay few seconds to assess the erythema happened. It will be vivid erythema, stronger, or even the strongest erythema you saw before. You have to decide which degree of erythema you got, and you have to see homogeneous one. So if there is skip areas, you can make redo for the skip areas of erythemas. Here we can see skip areas here and the temple. Elevate your chin. Now we are going to do the mandibular area. We will do the mandibular area here and make also peeling for this part, not to make demarcation lines between the face and the neck. The complexion difference between the face and neck in our patient is minimal, so we will do this on a minimal degree. You see the quantity and about to be finished, so you have to be economic in your sessions. Again, we can do the third layer. You check your cotton saturation like that, and you start to make the forehead again. Don't forget the areas approaching the frontal hairline like that. The nose, you start by T-zone, then stretching and making the cheeks. Don't make overlapping, and skip areas try to do. The other one. لسه حسب وجع. You frequently ask your patient الوجع فين أكتر؟ والخدود. You feel the lag between the pain, because I started here, she point, this is a painful point. After a few seconds, she will feel pain here. And the last point, as I said, very simple around very oral area. Now we will do the mandibular area like that. حاسة بوجع فين؟
كله دلوقتي عشان
كله. Okay, start to feel pain. If you look here, I cannot see strong erythema in this part, so this is a skip area. You have to make like that. Again, in the other part, this also. You have to stretch the skin and make another layers. Okay. There is a special formula for periorbicular area we can use, but not that formula, of lesser concentrations and synergistic effect between lactic acid, little bit phenol, little bit TCA. We have special formulas for such sensitive areas. Also, peeling of the lips can be done by special formulas. The immediate aftercare after peeling is neutralization. You might use, you might not use. So in our case, I do prefer to use the neutralizer. Upon using, you can just simply close your patient eye and direct. And deploy the neutralizer on the skin for the forehead area and for the eyes. Okay. And spread by your fingers directly like that to the whole face. في ألم في وجع. المفروض النيوترلايزر يقلل الوجع شوية. لسه حاسة بألم؟ هنا. Every now and then you ask your patient about the pain. Because of this, we don't use any anesthesia before peeling for two reasons. First of all, the pain guide you. Where is the most intensified point you might put your neutralizer. The second reason is the base of any anesthetic cream will interfere with the peeling agent itself. For now, we will let our patient to go to water cabinet and wash her face thoroughly by water only, without soaps, and she will come back and we will put bland emollient immediately for her. The immediate aftercare is the using neutralizing spray, or the patient go and wash her face thoroughly with water. We did both. We make neutralization, and after a while, she wash her face through the water. Now you put just bland emollient after the procedure. Any bland emollient you use, but the patient should not have any allergy to its component, because sometimes patient develop simple contact allergy for the emollient use. It is very rare, but it happens. So you should use the patient personal emollient. She should not have any allergy from it. And you know this by the history. After deploying the emollient cream like that to the whole face, and to be sure with final revision about the erythema happened, the end point, and take care not to see frosting, because if there is frosting or super frosting in parts, it means that the pyruvic acid action was so strong in this part, and I think it will gonna to do medium depth peel in this point, just to take care. After this, you ask your patient final question: do you have pain? في وجع? Okay. After this answer, she might stay in your clinic for further 15 minutes or 20 minutes to be sure that everything is okay. She will take her umbrella of emollient use. Please don't prescribe any topical steroids. you might prescribe preparing creams, topical creams, and you will see your patient after 1 week. Thank you. Hello everyone. Now we are going to do a peeling session in a dark patient in skin type 3 or 4. Now you see with me how to make assessment for our patient. Her complexion is sure skin type 3 at least. She still have acne, active acne here, and liability to make acne scarring also. Okay? She has different complexion in the peri or peculiar area than the rest of her face. You should take this in consideration upon doing the session, as we will see right now. Assessment of the patient done before. We make rapid assessment just for the video presentation. Priming of such skin has done before using topical retinoids for at least 2 or 3 weeks prior to the session. And if your patient is a little bit darker in complexion, skin type 3 or 4, I do advise that the priming time should be more and more. Should be at least 4 weeks or 5 or at least 6 weeks, as you can take in priming or preparation of his or her skin before the session itself. We will start now the peeling steps. We will do degreasing for the face using ethanol. The degreasing is important because it removes the dirt, the sebum, which might act as a barrier, and you look every time to your swab or cotton or gauze, okay, to assess the degree of seborrheic status of your face, of the patient face, sorry, okay. On the nose, you should make good degreasing because she has a lot of black heads here. We make degreasing for the second time. You have to make all the face. Don't make vigorously in the area around the mouth, because as I told you, it is sensitive area in our patients. In Egyptian patients, in Sudanese patients, this is very sensitive and liable for pigmentation. So the trauma induced by peeling agent should be very minimal in this area, and you should use special blends, not regular blends for such place. Now, after degreasing, we will use our ordinary cotton swabs again to choose the peeling agent for such patient. We have a patient with a skin type 3 or 4 with acne, active acne, so my choice will be Jessner solution. The components of Jessner solution is lactic acid 14%, salicylic acid 14%, rosuresinol 14%, and the net result will be in ethanol up to 100 ml as a volume. Again, we will not use our cotton swabs inside the bottles. It is better to be done like that. You open the main bottle and put like 2 to 3 ml of the solution in a separate bottle, and don't forget to close the main bottle because ethanol is a volatile one. So the concentration in your main bottle will differ by time. And now we will use, again, not to make your cotton swab super saturated, and we will start our layers from the forehead like that. And every now and then you should ask your patient about the pain sensation. Jessner, he is a weak peeler, superficial peeler, but he is painful. Take care. في أي ألم في وجع؟
تحرق شوية بس.
شوية. ده مهم. We will make like that. Okay. Don't forget the mandibular area, and you wait for few seconds. Again, we prepare for the second layer. In Jessner or modified Jessner, we use up to 8 layers because, as I told you, he is generally a weak peeler, superficial peeler, so you should be generous in the amount like that. If you have active lesions here, you might use your cotton swab, which is not super saturated, to be done like that. If you make close-up for the forehead, you will start to see start of pseudo frosting. It might not be super obvious, maybe more obvious after the third layer. You have to be homogeneous, you have to touch the hairline like that, on the nose, again on the face layers. Usage of broadly based cotton swabs like that makes the mission is very easy. Here you start to see the pseudo frosting about the active inflammatory points. It is the rule in all salicylic acid based peelers. You should see the pseudo frosting as end point for your work. And the more pseudo frosting and the more homogeneous, more obvious, it means the end of your session. Otherwise, you continue to put more layers. Putting more layers may tell you that this patient is a little bit seborrheic than you expect, or not well prepared by using topical retinoids. Again, preparation of the patient with dark complexion, like our patient today, is very important. It's crucial point indeed before you do the peeling for her. So the frosting is starting to be obvious. And don't forget, ask your patient about the pain. في وجع؟
شوية.
فين؟ Okay. Pointing to the painful areas is important and to guide you in your work. I think this is the fourth layer I did. I'm going to do the fifth one. Again, I will start from the forehead. Rapid maneuvers like that. Don't forget the area of the nose, and we jump to the face. Be away from this area, as I told you, at least with super saturated cotton piece. You may use like feathering like that with not super saturated cotton piece. And don't forget the neck and make feathering for the mandibular area. Here in this part it's start to be pseudo frosting and obvious. Again we ask about the pain. الوجع اخباره ايه؟ ما تتكسفيش قولي. مؤلم؟ فين في الخدود؟
هنا
Even she point to the place which has more obvious pseudo frosting. Okay, this is my sixth coat. Again, I will start from the forehead because it's resistant by its nature, and I will start here, and I will press my hand. I will press my hand like that. First, I make it light pressure on the swab, but because I don't see obvious pseudo frosting here, I think the patient is a little bit more seborrheic or don't use the priming protocols very nice. You can test the cotton here, and you can try to do this and to do this part, but not to do it in a vigorous way. This part is liable for pigmentation on racial issues. الوجع اخباره ايه؟
شكله بيحبه.
كله دلوقتي يعني هنا وهنا
هنا
وهنا كمان. طب وتحت هنا؟
لا.
Okay, we have still amount in our Jessner, and we are doing now the 7th and the 8th layer. بص كده هنا. ايوه. Stretch the skin by your finger to make spreading of the material easier for you. Don't forget escape areas. It's better to start from medial to lateral direction and supra-orbicular areas related to eyebrows. Don't forget to make blending of the face with the anterior hairlines by your material. It contains a lot of acne lesions, especially in the younger people. Continuing to make more layers, I think this is the 6th or the 7th, and you start to see the pseudo frosting for the face. In using Jessner, it will not be homogeneous pseudo frosting. It will be dedicated to the area of most prominent inflammation of acne. Again, the periorbicular area is area of interest. We don't use this blend. We use different blends, and I make all the face, and I just leave this area and make very little in feathery directions of not super saturated cotton swab, like that manner. And we keep asking the patient about the pain. في وجع في الوجه كله. Guidance by the pain is so important in peeling sessions, and as I told you in the previous video, we don't use any topical anesthetic creams before such procedure. The immediate care for our patient now will not be using anti-acid or neutralizer spray. We will go directly for water cabinet and make thorough rinsing of the face by solely by water. We don't recommend to use soaps anymore. And after she come back, we will use again the bland emollient of her choice, of her daily routine. It will be the best emollient you can use in such setup. At least you will avoid any allergy to one of its components. Thank you.